Thank you. This is for Mr. Bauer, and then I have one for Mr. Zook. We've been getting texts up here. As you can imagine, a lot of people are watching this all across the state, and one of them is from a constituent back home. And it says, Representative Lundstrom, you are my state representative. I am a current Tyson employee, and I'm strongly against the corporate mandate. Several corporate positions can be done remotely. We did it for 1.5 years. Why won't Tyson consider working remotely so that they don't have to choose between a vaccine that they aren't sure about, at least until the FDA approves or we get more information, more data? All of these people truly love working for Tyson. That says a lot about the company. So that's their first question. Why not have an option for working remotely? Obviously, these people enjoy working for Tyson.
Yes, ma'am. If individuals apply for an accommodation for medical or religious beliefs, then working from home would be the only type of accommodation that would be considered if it fits the job.
I'll keep going. Obviously, we have bright employees as well. What happens if the corporation upholds a mandate and are left with only vaccinated employees and still have COVID-positive cases and variant outbreaks? And what if, or what will we roll up into the mandate in the near future? There's no written policy currently. Right now, they say they have proof of full vaccination. Emergency use vaccinations that are not FDA approved, and it's not slowing the spread of the variants. If Tyson says they're following the CDC guidelines, and if this fall the CDC boosters, if this fall the boosters are recommended, will we have to do that as well? How long will this go on? Obviously they're watching, and obviously they care.
Yes, ma'am, and I care about them too. There were a lot of questions in
Yes,
there.
let's talk about the boosters and how long will this continue? Will we just keep going on and on and on?
It's hard to predict where COVID-19 will end and how the pandemic will finally come to an end. We will wait for the FDA and the CDC to advise us about boosters, and when they do, we will have to evaluate them and make a decision. So they're not there yet. There's no advice on them yet, and our doctors would have to look at that.
Okay, thank you. Mr. Zook, you mentioned that we had obviously a staffing, so obviously it doesn't end. You mentioned we have a staffing problem in the state, 80 to 90,000 jobs, and nursing came up at the very beginning of this conversation. I want to circle back and end there. Nurses at the very beginning of this epidemic were obviously terrified, but they still showed up for work anyway. And now hospitals are saying you have to get the mandated vaccine. And we have hospitals now in Northwest Arkansas. One of our hospitals had 20 nurses decide to take early retirement. And another hospital today, talking to a nurse, said they're leaving, they're going. So nurses are leaving, and we have a nursing shortage. Why would we not want to keep these nurses that showed up when we had a pandemic and we didn't know what to do? Why would we want to lose those nurses?
They don't care.
I don't think anybody does want to lose them. I don't see anything that's inconsistent with what
If they don't want to get the
Washington
vaccine,
Regional and Mercy Op systems have both mandated the vaccine and given a period of time to get the vaccine.
well,
They certainly don't want to lose anybody because they're shorthanded. They're out of capacity based on the staffing levels.
so the thank you note that we give them for showing up when they didn't know what was going on is, see ya. You don't want to get the vaccine, you're out of here.
I wouldn't interpret it that way. Things have changed. The information that the management has, the information that the medical officials have is different today than it was then.
And nurses have lived that.
I'm sorry?
And nurses have lived that all along. They've lived
I
that.
get that, but they've got more information, better information, and they're making the best possible decision they can make.
Should nurses make, the nurses need to make the best possible decisions they should make too. We pay them to make the best possible decisions, and they're making the best possible decision for their health. and they don't agree. They want, some of the nurses that have talked to me and said, we want to wait a year, we want to get pregnant. There's a lot of different good, valid reasons for waiting. We can't afford to be so frivolous with good, quality help.
They don't care.
And I just find it wasteful that we would actually have, we spent 1.2 million, we agreed to do this, I believe it was yesterday, to bring in nurses from out of state to make up for the nursing shortage we're going to have here in Arkansas, because we aren't wise enough to keep good quality people. So it's just, I'm just flummoxed. If you have any great
I
solutions,
think we
I'd
all,
love to
I
hear them.
don't have any great solutions. It's a tough situation.
Well, like you said, $5
And I don't
per
envy
cup.
those that have had to make